Okay, welcome, Pahrump. I'm your host of the Independent Doctors of Pahrump, Dr. Michael Reiner, and this is a live show. It is Monday, May 18th. Call-in number is 727-8750. That should be at the bottom of the screen for those that want to pick up the phone and call in. The last time I did the show, we had quite a few calls, and I think that's a great thing. It's your free way to get a curbside consult on any medical issues and questions you may have. I certainly don't have all the answers, but I try and have some of them, or can at least postpone the answer until next week until I can look that up and give you the best information available for those particular topics that you may have. With that, I like the calls because they actually spark really good conversation, and then I don't have to go to the trouble to put a show together on a PowerPoint, so we will go for that. And I think we have Ray on the phone. Ray?
Yes, you do, Doc. How are you doing tonight?
Oh, I'm good, but they didn't hook up the microphone, so they may have to relay the message. So tell me what's on your mind.
Okay, years ago, my dad had a problem where he was losing weight and feeling very sluggish, and I took him in. He got a vitamin B12 shot, and he snapped out of it. Is there some truth to that vitamin B12, because your body, when you get older, it doesn't assimilate that vitamin, that a vitamin B12 shot can help you out?
Yeah, this has been an ongoing issue in medicine. I had a lot of patients who would come in and get a B12 shot. Certainly, let's talk about pernicious anemia, which is a B12 deficiency, and that it really is a medical issue, usually of Scandinavian descent, and you have difficulty absorbing B12 in the intestinal tract. And it can lead to what they call macrocytosis, which is very large red blood cells. Of the people that get B12 shots or used to get B12 shots, they basically felt this energy boost from the B12. And so they would continuously come in and get the shots. Now, whether or not it really helped or not, it's a placebo effect. So when someone has that issue, meaning they're weak, tired, and not feeling well, and they get an injection, sometimes it's really hard to know the difference between what's real and what's not real. Now, with regards to the injections, I didn't really like giving injections, because whenever you give an injection, you're taking a needle, you're putting it in the skin, you're having a risk of infections and secondary complications as a result of B12 injections. And yes, you can get a higher than normal level. Normal levels are around 1,000 in the bloodstream, and I think it's nanograms or whatever the lab reference measurement is. But since then, we've actually I wouldn't say it's a study, but sublingual B12. You can buy the drops over the counter, and in patients that I have told to place sublingual, which means under the tongue, B12, their values were just as high as the patients who had injections. The issue is to bypass the first pass through the liver. So, I mean, if you take a B12 by mouth, everything gets absorbed into your intestinal tract, and it goes through the liver, where the liver sucks it all up out of your system, so it never really gets into the peripheral circulation. So you were to bypass that by giving injections or taking sublingual drops, and they have returned values that were just as good as injections. So it's an individual thing. If you want your B12 level checked, I would think that's an easy test to do. And the other thing is, if you're eating 2 regular meals a day, you're probably getting all the vitamins that you want in your system. And it brings up another topic, which is when you go to the store and you actually buy nutrients and supplements, it's very important to read the labels. And you will see on the back of that what the USDA requirement is, and that's the daily, the set values for certain vitamins. And what you end up doing is, if you read them, it says, okay, so vitamin E is 400%. That means that dose is 400% of what you should be taking on a daily basis. So if you took that vitamin E every day, you would be increasing your body's content of vitamin E. Now, within the vitamin family, there are water-soluble vitamins and fat-soluble vitamins. Fat-soluble vitamins are A, E, I think D, and a few others. They are dangerous in the fact that you can actually have side effects, pseudotumor cerebri from vitamin A, and some other really complications from becoming toxic with those vitamins because they saturate into your fat stores. So you have to be very careful when you look at these products. Especially if you take a multivitamin, look at the list. And if one is 200, 300, 400%, then in reality, you should not be taking that vitamin other than once every 4 days. I know there's some biotin is like 37,000% of the USDA requirement. So, and then if you believe the government, but I think this data has been around for a long time, so I don't think it's been altered, but I couldn't say that for sure. But that being said, something that's 37,000%, you probably wouldn't take it once in 3 months. So you really need to pay attention to the requirements. I think vitamin D is a very good vitamin. You'd be surprised how many people are low in vitamin D. It is an anti-inflammatory. It's very good for bone health. And really, if you're going to get sun, you need to get sun in your arms and legs for 15 minutes a day with no sunscreen. Sunscreen blocks the formation of vitamin D in your body. So if you think you're going to get out and convert, vitamin D, convert all the vitamin Ds by getting the sun, and you put sunblock on, you are sadly mistaken with regards to vitamin D. So you need unaltered sun to be able to do that. And we're going to go to break. I guess we have a short break, and then we're going to come back, and we'll talk a little bit more of that. And Ray, if you have any questions, you're still on there, please call back. We'll be right back. Thank you. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.